Our topic for today is the superficial structures of the neck. Now let us discuss about the muscles of neck. We have two types of muscles. They are suprahyoid and infrahyoid. Suprahyoid muscles are above the hyoid bone. Infrahyoid muscles are below the hyoid. We have four suprahyoid muscles and we have four infrahyoid muscles. Now let us see the muscles and the diagram. This is the hyoid bone here. So now let us see the suprahyoid muscles first. And these are the suprahyoid muscles. This is the genohyoid muscle. This is the anterior belly of the digastric muscle. And this is the posterior belly of digastric muscle. And this is the mylohyoid muscle. And this is the stylohyoid muscle. Now let us mark them. This is the genohyoid muscle. This is the anterior belly of the digastric muscle. And this is the posterior belly of the digastric muscle. And this is the mylohyoid muscle and this is the stylohyoid muscle. Now let us write them. We have four suprahyoid muscles. They are genohyoid and the second one is digastric and the third one is mylohyoid and the last one is stylohyoid. Now let us see the infrahyoid muscles. As we already discussed, the muscles above the hyoid bone are the suprahyoid muscles and the muscles below the hyoid bone are the infrahyoid muscles. These are the suprahyoid muscles here and these are the infrahyoid muscles. Now let us see the infrahyoid muscles. This is the hyoid bone. This is the sternothyroid muscle. This is the sternohyoid muscle. See, this is the sternothyroid and this is the sternohyoid. And this is the thyrohyoid. And this is the omohyoid. This is the thyrohyoid muscle. And this is the sternothyroid muscle. This is the omohyoid muscle. And this has the two bellies here. This is the superior belly of the omohyoid muscle. And this is the inferior belly of the omohyoid muscle. And this is the sternohyoid muscle. First one is thyrohyoid and the second one is sternothyroid and the third one is omohyoid and the fourth one is sternohyoid. As we already know, omohyoid has the two bellies, that is superior belly and the inferior belly. Now let us see the nerve supply of the infrahyoid muscles. The first muscle is sternothyroid. For the sternothyroid muscle, the second muscle is omohyoid muscle, and the third one is sternohyoid muscle. And all these muscles are supplied by ansa cervicalis. And we also have one more muscle, that is thyrohyoid muscle. This thyrohyoid muscle is supplied by the cervical plexus, that is C1 fiber, through hypoglossal nerve. That is all about the muscles. Now let us discuss about the triangles in the neck. As we already discussed the muscles, few muscles forms the boundaries of the triangles here. Now let us see the major triangles. There are two triangles here. They are posterior triangle and the anterior triangle. The major landmark here to discuss is the sternocleidomastoid muscle. This muscle forms the two triangles. They are anterior triangle here in front of the sternocleidomastoid, and posterior to it is the posterior triangle. And we have the subdivisions in the anterior and posterior triangles. Now let us see them. Now let us see the posterior triangle is divided into the two triangles. This is one triangle and this is the one more triangle. This triangle is known as occipital triangle and this is the omoclavicular triangle. These two triangles are divided by a muscle known as omohyoid muscle. This is the inferior belly of the omohyoid muscle. This omohyoid muscle divides the posterior triangle into the two triangles, that is occipital triangle here and the inferior one is the omoclavicular triangle. Now let us see the divisions in the anterior triangle also. We have the four triangles in the anterior triangle. They are submental triangle. This is the submental triangle. And this is the carotid triangle. Let me highlight it. This is the carotid triangle. Now let us see the triangles in the anterior triangle. This is the submental triangle. This is the carotid triangle. And this is the submandibular triangle. And this is the muscular triangle. This is the carotid and this is the submental and this is the muscular and this is the submandibular triangle. Now before drawing our own diagram, first let us see the muscles. This is the anterior belly of the digastric muscle and this is the posterior belly of the digastric muscle. In between these two muscles, we have this is the submandibular triangle. This is the anterior belly of the digastric muscle and this is the posterior belly of the digastric muscle. And in between them we have submandibular triangle. And between the two anterior bellies of the digastric muscle, we have submental triangle. This is submental triangle. This is the carotid triangle. And this muscle here is the sternocleidomastoid muscle. This muscle is the sternocleidomastoid. And we have the muscular triangle here. And now let us see the posterior triangle. This is the inferior belly of omohyoid muscle. This is the sternocleidomastoid muscle. This is the omohyoid muscle. This is the trapezius. This forms the posterior boundary of the posterior triangle. Now, above the omohyoid muscle, this is the occipital triangle and this is the omoclavicular triangle. Okay. Now let us draw our own diagram for the triangles of the neck. Now let us see. This is the mandible and this is the mastoid process of the temporal bone. And we have one more mastoid process here. We have hyoid bone here and we have sternum and this is the clavicle and this is the scapula and this is the clavicle and this is the scapula. Now first let's draw the digastric muscle here. As it has two bellies, this is the posterior belly and this is the anterior belly. And this is the anterior belly of digastric and this is the posterior belly of the digastric muscle. So below the mandible we have submandibular triangles. These are the submandibular triangles. And in between the two anterior bellies of the digastric muscle, we have submental triangle. This is the submental triangle. Let us draw the sternocleidomastoid muscle. As the name mentions, it is attached to both sternum and the mastoid process. This is the sternocleidomastoid muscle. Now let us draw the sternocleidomastoid muscle. As its name mentions, it is attached to the sternum bone and the mastoid process of the temporal bone. This is the trapezium. This forms the posterior triangle. All this is the posterior triangle. It is formed by anteriorly we have the sternocleidomastoid muscle and posteriorly we have the trapezium muscle. And below we have the clavicle. Now this posterior triangle is divided into two triangles by the omohyoid muscle. This is the inferior belly and this is the posterior belly of the omohyoid muscle. This is the occipital triangle. Superior to the omohyoid muscle is the occipital triangle and inferior to it is the omoclavicular triangle, or we also called it as supraclavicular. This is the occipital triangle. And here we have one more triangle. This is carotid triangle. Now let us draw an imaginary line here. Now this is the muscular triangle. Now let us see all the triangles. This is the mandible, this is the mastoid process of the temporal bone, and this is the another mastoid process of the temporal bone. This is the posterior belly of the digastric, and this is the anterior belly of this digastric muscle. In between these two muscles, we have the submandibular triangle. This is the submandibular triangle, and this is also the submandibular triangle. And in between the both anterior bellies of the digastric muscle, we have the submental triangle. This is the sternocleidomastoid muscle. And here, this is the trapezium muscle. These both forms the posterior triangle. Anterior to the posterior triangle is the sternocleidomastoid and posterior is the trapezius muscle. This posterior triangle is divided by the omohyoid inferior belly of the omohyoid muscle. And superior to the omohyoid muscle is the occipital triangle and inferior to it is the supraclavicular triangle. And here we have another two triangles. This is the carotid triangle and this is the muscular triangle. Now let us discuss about the structures in the posterior triangle. Before that, let us discuss about the boundaries of the posterior triangle. First, let us see the anterior boundary here. Anterior boundary. Anterior boundary is formed by the posterior border of the sternocleidomastoid muscle. This is the posterior border of sternocleidomastoid muscle. The posterior boundary is formed by the anterior border of the trapezius muscle. This is the anterior border of the trapezius muscle. And we also have the floor, the roof, and base. Now let us look at the base. Base is formed by the clavicle bone. Now let us discuss the floor and roof in another diagram. Now let us discuss about the floor. Floor of the posterior triangle. Floor is formed by the five muscles. They are splenius capitis muscle, levator scapulae muscle, posterior scalene muscles, anterior scalene muscle, and the middle scalene muscle. All these forms the floor of the posterior triangle. Now let us mark them in the diagram. This is the splenius capitis muscle and this is the levator scapulae muscle This is the posterior scalene muscle, and this is the anterior scalene muscle, and this is the middle scalene muscle. This is the scaneus capitis. This is the levator scapulae muscle. This is the posterior scalene muscle, and this is the anterior scalene muscle, and this is the middle scalene muscle. Now let us write them. We have five muscles. They are scaneus capitis, levator scapulae, posterior scalene muscle, anterior scalene muscle, and the middle scalene muscle. All these muscles form the floor of the posterior triangle. Now let us draw our own diagram to remember all these muscles. Just draw a triangle first. Here we have scaneus capitis. This is levator scapulae. This is the anterior scalene muscle. This is the middle scalene muscle. And this is the posterior scalene muscle. All these muscles form the floor of the triangle. Here, all these muscles are covered by the prevertebral layer of the deep cervical fascia. Now, let us see the roof of the posterior triangle. This is formed by the investing layer of deep cervical fascia, also formed by the cutaneous branches of the cervical plexus. And these cutaneous branches of the cervical plexus are also the contents of occipital triangle. Now let us discuss about the veins in the posterior triangle. The major vein here is the external jugular vein. This is the external jugular vein. This external jugular vein is formed by the retromandibular vein. Here this is the retromandibular vein and this is the posterior auricular vein. This is formed by the joining of retromandibular vein here and the posterior auricular vein. These both join together to form the external jugular vein at the angle of the mandible. They join together at the angle of the mandible. This is the angle of the mandible. Now later, this external jugular vein descends down and drains into the subclavian vein. Now, let us draw the diagram here. This is the retromandibular vein and this is the posterior auricular vein. Combine together and form external jugular vein. This external jugular vein is formed at the angle of the mandible and later then it descends and drains into the subclavian vein. We also have two more branches here. They are transverse cervical vein and the suprascapular vein. These are also the veins which are present in the posterior triangle. That's all about the veins. Now let us discuss about the arteries in the posterior triangle. First, let us see the subclavian artery. This is the third part of the subclavian artery. We cannot completely see the subclavian artery here. So now let us draw the diagram for it. This is the subclavian artery and above this we have the anterior scalene muscle. This is the anterior scalene muscle. This anterior scalene muscle divides the subclavian artery into the three parts. This is the first part. This is the second part, which is posterior to the anterior scalene muscle. And this is the third part. This is the third part, which we can see in the diagram. And we also have the transverse cervical artery and the suprascapular artery. This is the transverse cervical artery and this is the suprascapular artery. This transverse cervical and this suprascapular arteries are arises from the thyrocervical trunk. Now let us see the thyrocervical trunk in the diagram. This is the thyrocervical trunk. This here is the thyrocervical trunk. This transverse cervical artery passes anterior to the anterior scalene muscle. This is the anterior scalene muscle and this is passing anteriorly. And this also passes anterior to the brachial plexus. Transverse cervical artery passes anterior to the anterior scalene muscle and also anterior to the brachial plexus. This Transverse cervical artery again divides into the superficial branch. This is the superficial branch, and this is the deep branch. This is the superficial branch, and this is the deep branch. We have two branches. This is superficial branch and deep branch. Deep branch supplies to the rhomboid muscle, and the superficial branch supplies to the trapezius muscle. This is all about the transverse cervical artery. This is the suprascapular artery. The suprascapular artery supplies the posterior muscles of the scapula. See here it goes into the posterior side of the scapula. That is all about the arteries in the posterior triangle. Now let us discuss about the nerves. Now let us discuss about the most superficial nerve, that is the accessory nerve. Here it is. This is the accessory nerve, and this is also the accessory nerve here. Let me zoom it and show you. This is the accessory nerve. This is also the accessory nerve. This accessory nerve exits from the cranial cavity through jugular foramen, and this accessory nerve innervates the sternocleidomastoid muscle. This innervates the sternocleidomastoid muscle, and it reaches up to the trapezius muscle here, and it also innervates the trapezius muscle. Now let us discuss about the cervical plexus. These plexus are formed by the anterior rami of cranial nerves C1 to C4. There are two types of branches here. They are muscular branches. We also have cutaneous branches. These are the muscular branches and these are the cutaneous branches. Muscular branches are also called as the deep branches. Some of the muscular branches are phrenic nerve. Now see, this is the phrenic nerve. This is formed by C3, C4 and C5. Now let us see them in the diagram. This is the C3, C4 and C5. Branches from C3, C4 and C5 forms the phrenic nerve. Muscular branches also supply the muscles. They are rectus capitis anterior. This is the rectus capitis anterior and the rectus capitis lateralis. Also supply the rectus capitis lateralis and also the longest coli and also the longest capitis. And these four muscles are also supplied by the muscular branches of the cervical plexus. Cervical plexus also forms the superior root of ansa cervicalis and the inferior root of ansa cervicalis. The root value of ansa cervicalis is C1, C2, and C3. Cutaneous branches are lesser occipital nerve. This is the lesser occipital nerve. And we also have the greater auricular nerve. This is the greater auricular nerve. This is the transverse cervical nerve. And we also have the supraclavicular nerves. These are the supraclavicular nerves. Now let us see. This lesser occipital nerve supplies the skin of the neck, also supplies to the scalp, posterior to the ear. This is the greater auricular nerve. This greater auricular nerve supplies to the skin of the parotid region, the ear, the mastoid area. We have the transverse cervical nerve. This transverse cervical nerve supplies the lateral and anterior parts of neck. This supplies, and these are the supraclavicular nerves. So these supraclavicular nerves supply the skin over the clavicle. Let us discuss about the brachial plexus. We can see the brachial plexus here. These are the brachial plexus. These are between anterior and middle scalene muscles. They are formed by the anterior ramen of C5 to C8. The T1. Only the roots of the brachial plexus in the posterior triangle. We only have the roots here. The plexus also includes the dorsoscapular nerve, long thoracic nerve, the suprascapular nerve. And these are all about the structures which are present in the posterior branches of the. Now let us draw our own diagram for the cutaneous branches. Now first draw a triangle here. This is the greater auricular nerve, and this is the lesser occipital nerve, and this is the transverse cervical nerve. And now here, these are the suprascapular nerves. The point here where all the nerves meet is the nerve point. This is the nerve point. Now first let us see the contents in the occipital triangle. Before that, let us see the boundaries. Anteriorly, we have the posterior border of sternocleidomastoid muscle. Posteriorly, we have anterior border of trapezius muscle. And at the base, we have inferior belly of the omohyoid muscle. Now let us see the contents. As we already discussed in the previous diagrams, we have spinal accessory nerve, we have the cutaneous branches, we have greater auricular nerve, lesser occipital nerve, the transverse cervical nerve, and the suprascapular nerve. We also have the roots of brachial plexus, and we also have the occipital artery, and we have one more transverse cervical artery, which is the branch of thyrocervical trunk. We have three branches from the thyrocervical trunk. They are suprascapular and inferior thyroid and the transverse cervical. And we also have the occipital nodes. That's all about the contents in the occipital triangle. Let us see the contents in the suprascapular triangle. This suprascapular triangle is also known as omoclavicular triangle. This is called a suprascapular triangle because this is above the clavicle. Let us see the contents. We have the third part of subclavian artery. We also have the subclavian vein, and we also have the suprascapular artery, the suprascapular nerve. We also have the nerve to subclavius, also the long thoracic nerve. These are the contents of the suprascapular triangle. And that's all. Thank you for listening and happy study.